Hello, risk adjustment learners, innovators, and operators. Welcome again to another week of the Hughes Academy Risk Adjustment Made Easy, the Medicare Advantage kind. And this is your host tutor, Dr. Prince Belwa. Today we'll be going over more of the implications of Medicare Advantage Risk Adjustment on some of the stakeholders that we identified. I know last week we went through some of the implication for patients and also for providers. And today we'll be following on some of the implications for medical coder and also for health plan. For medical coders, we are using Miss Jones and Mr. Clark as an example, and we learned about them from the previous episodes that we've gone through. As Miss Jones see her provider, the provider takes some notes in the medical record, and those notes and the stories about Miss Jones are pulled together by the medical coders into medical codes, right? So the risk adjustment models do not take stories, they take medical codes. And it is the medical coders that are coding these stories into a form, a language, a standardized languages of medical codes that are used to feed these risk adjustment models. For example, Miss Jones, 66 years old. We have been learning about Miss Jones over the last weeks. We know that Miss Jones is 66-year-old female, has one chronic condition, lives at home, and get a risk score of zero point 0.8 with a relatively lower risk score than Mr. Clark, right? And for this chronic conditions mostly, to get to into the risk adjustment models, these needs to be coded. So the medical coders now have to take the provider notes and convert them into these standardized medical codes. So for example, with this one, we are looking at the chronic condition. So this one chronic condition, other specified diabetes mellitus with diabetic cataract, the medical coder would take this information that the provider wrote down, this chronic conditions, and turn it into E1336, which is the ICD code, right? The ICD code is the medical code, that is the diagnostic code that tells the risk adjustment model that Miss Jones has other specified diabetes mellitus with diabetic cataract. So the medical coder's work is very important because now the coder is converting these stories into standardized codes that are being used to feed the model. Another example with Mr. Clark, we learned that Mr. Clark has 4 chronic conditions, other specified diabetes mellitus with diabetic cataract, which is E1336, which is the ICD code, which is the International Classification of Disease Codes. And Mr. Clark has end-stage renal disease. The coder will code it N186. Mr. Clark has primary pulmonary hypertension, I270, and other hypertrophic cardiomyopathy, which will be converted to 1422. So we see the importance of the medical coder in this, in understanding the provider written stories and converting them into the appropriate medical codes that feeds the risk adjustment model. We'll be going to a health plan. We're using Miss Jones and Mr. Clark again. Last week we talked about the implication for patients as they select benefit packages, right? We learned that their benefit packages that they might select might be different. And who designs those benefit packages is the health plans, right? So as a health plan, understanding the risk of your population, knowing how much expected cost help you in anticipating how much money you're going to get, what benefit packages you are to put together, who to contract, depending on the risk that your beneficiaries have, right? So health plans, understanding risk score is very important because it helps you design value-based benefit packages that meet the needs of your enrollees and who to market to. That is what we have for today. As we end, I want to emphasize that we have the resources that are there that goes with these implications on our website. You go to thehughesacademy.com, you go to the resources, and then you're able to download it. I can go and show you here. You can look at the other videos, but you go to the website, you navigate to the resources, and you get the Medicare Advantage Risk Adjustment Basics 1. What is risk adjustment? You can download the PDF or the PNG one, and you should be able to have access to the cheat sheet that goes with this resource. And also, I want to emphasize again that if you have not downloaded our signature gift, it is here: From Chaos to Clarity, the Essential Medicare Advantage Risk Adjustment Data Sources Comparison Cheat Sheet. And it compares, you can see from here, different data sources, either from claims data, from RAPS data, encounter data, and compares them, the differences and the similarities across. Thank you so much again for joining the Hughes Academy. Risk Adjustment Made Easy. Please don't forget to share, to like, to subscribe to our channel, and also to reach out if you have any other questions or comments. And see you next week.